Welcome, Mountain Mamas, to this week's Zoom training. First, we're going to get started on our first aid portion. This is women and children illnesses. We can also talk about men's illnesses, but just for the reason that we're just Mountain Mamas and most of the people who are taking will be women, we're going to focus on that. And then we'll conclude with children illnesses, which are and injuries and things like that, just specific. So we're all women, and I feel like when you think about the women issues that could happen, mostly it's bleeding. I think that's the biggest thing we're worried about. And as a guide or anyone that's out there leading a trip, I feel like that's your biggest concern. So the first thing, if a woman comes to you in your group and she's complaining of abdominal or pelvic pain, last week we talked, or last Zoom meeting, we talked about abdominal injuries and concerns with that. And so you can kind of ask all the questions that we talked about in that previous Zoom training. And if that kind of rules out anything obvious, I would say anytime you have abdominal pain or concerns in that region, I would always just start up by asking a woman if she's pregnant. Now, you might want to do this discreetly. I usually say, is there a chance that you could be pregnant? Because a lot of women would know if they're trying to get pregnant, ask, is there a chance that you could be pregnant? Should we take that into consideration? If she is pregnant, that changes this into a whole other ballgame. So let's say she's like, there's no way in this God's green earth I could be pregnant. Okay, then we're worried about we're not worried about a child in the middle of a pregnancy in the middle of all this. We're just worried about any sort of abdominal or uterine issues or fibroids we could have, all sorts of things like that. Usually I would just ask the woman, do you have a history of any sort of, female, I don't know if you want to say like pelvic pain, any sort of injuries or anything like that. Like if they've got endometriosis, just ask them any sort of female gynecological history. Because they might be able to tell you, oh, yes, I spot bleed because this, blah, 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 blah. So we want to kind of rule out anything that might be chronic. That's something that's not really concerning. We're mostly worried about things that are new for them and that might be potentially life-threatening. So the things that we're not really worried about is, say like a woman starts her period on a hike, something like that. That's not as concerning. And obviously she probably wouldn't come to you with something like that. But if she's says I'm experiencing abnormal vaginal bleeding, whatever that means to her, heavier than normal flows. This is coming in the middle of a cycle. And I'm also having abdominal pain and it's sharp and I don't know what it is. Those two symptoms are concerning. And we do want to just say, hey, let's get you should finish this activity, hike, rafting trip, whatever. We need to have you checked out by a doctor. So abnormal vaginal bleeding and abdominal pain, those two things are concerned. Now, if she's possibly pregnant, when you have those two symptoms, it's considered a rapid evacuation. And we want to get her out as soon as possible and get her to the doctor and essentially get an ultrasound and make sure nothing's going on with that pregnancy. Now, if she's having pelvic pain with fever and chills. So she's like, feels a little lower. You feel she's got a fever. As soon as you've got a fever and pain, you're instantly concerned about infection. So we've got some sort of pelvic, uterine, or some sort of infection that's going on down there, especially if she's got nausea and vomiting. She might have some watery, foul smelling vaginal discharge, things like that. We want to have her checked out by a doctor. So it's not as much as a rapid evacuation, but it's something like, depending on that temperature, if that we're getting over 100 degrees, we're like, your body is super sick and we need to get you checked out. So I would make sure that I would help her get out of that activity as soon as possible. Other things we might be worried about are vaginal infections. With a vaginal infection, you'll usually see excessive redness in the area, itchiness, increased vaginal discharge. Usually a woman would be able to know. These are things that I'm feeling coming up mostly on like campouts, backpacking trips and things like that. I feel like if this happened to a woman on a 2-hour hike, she wouldn't say anything to. But if we're seeing stuff like this happen overnight, we definitely want to talk to her about washing with water, keeping that area dry. Usually if a woman has chronic vaginal infection, she'll already be carrying something like gyne-lotrimin or monostat, or even diflucan. These medications you can use to kind of help treat those infections. So essentially, if we're seeing those kind of symptoms and they don't resolve in, say, 48 hours, in 2 days, then we still want to have her get out and get checked out by a doctor. And of course, like I said before, fever is a big thing we're watching. We're always checking for temperature. Temperature in the mountains is a little tricky. We've learned in our wilderness first responder that we usually don't do like an oral or like in an ear temp or even a temporal temperatures, because sometimes they can be inaccurate in the field. But we're looking, you can kind of do a hand feel and just kind of see if, but we're looking at a lot of other symptoms too. But yeah, it's tricky. Like core, if your core is getting a lot hotter, things like that, you're noticing a lot of face that's flushed. So yeah, kind of keep an eye on that for infection. And then urinary tract infections, we've all had those and they're super not fun. The symptoms we probably all know: increased urination, pain with urination, burning. You can get lower abdominal pain, blood or pus in the urine. Everyone's got their medley of symptoms that they are very much aware of. The things that we want to do is drink tons of fluid, drink and drink and drink and drink. Avoid sugary foods, avoid caffeine, alcohol. And when we're out in the mountains, we'll just want to wash regularly with water and a mild soap if you've got it. And, if that's not improving, if your symptoms, I'd probably consider having someone hike out. If we're on a 3-week or, 2-week trip, we'd want to have antibiotics with us. We'd probably treat with a broad spectrum, like a Cipro, fluoxetine. So anyway, those are some options for women's concerns and things like that. What are you ladies thinking? I want to go to our Zoom meeting, gals who are listening. Anything that you guys have heard of or concerns that you might have with women's issues and illnesses in the field? Any thoughts or anything? Okay. So if you don't have any, I would say the take home message for women issues is if they're abnormal bleeding and we've got abdominal pain that's persisting and getting worse, and if you can tell that there's a fever, then those are all three. And if they're pregnant, those would be the 4 things I would say. Let's get that gal out of there as soon as possible. UTIs, we can kind of muscle through sometimes and hydrate, but if that's not improving, then we also want to get out for that. All right. So that's women's issues. I'm going to stop actually, and we're going to start a new one for kids. So give me a sec.